So once again you are welcome to Angel Health Academy. Subject Community Health Nursing. Topic for the day is second part of School Health Services. School Health Services part 1 video included Introduction, Historical Development, Definitions, Nature and Scope, Need or Importance of School Health Services, Aims, Objectives, Principles, Common Health Problems in School Children, School Health Team, and role and functions of community health nurse or school health nurse in school health services. If you have not seen this video, I'll be given in the card. So you can watch this first, then you can follow to the second part of school health services. So in the second part of school health services, I would like to discuss in detail about the components, aspects, elements or activities of school health services or school health program. In general, there are 12 different aspects of school health services or components of school health services such as health appraisal or health monitoring, remedial measures and follow-up, therapeutic services, prevention of infectious or communicable diseases, healthful school environment, nutritional services, first aid and emergency services or care, mental health, dental health, eye health, health education, education for the handicapped children and school health, maintenance of school health records. So these are the 12 important aspects of school health services: health appraisal, remedial measures and follow-up, prevention of communicable diseases, healthful school environment, nutritional services, first aid and emergency care, mental health, dental health, eye health, health education, education of handicapped and school health records, maintenance of school health records. Broadly, the components or aspects or elements of school health services can be classified into 4 important areas. They are health promotive and protective services, therapeutic services, then rehabilitative services, and last one is school health record. So the elements of school health services or school health program broadly can be classified into 4 different areas like health promotive and protective services, therapeutic services, rehabilitative services and maintenance of the school health record. So let us discuss in detail about the components or aspects of school health services. The first part is health promotive and protective services. Health promotive and protective services includes 7 different categories of services. First is wholesome or healthful school environment, maintenance of personal hygiene, nutritional services, physical and recreational activities, promotion of mental health, health education and immunization. Let us discuss in detail one by one. First is wholesome or healthful school environment. The school is considered as the second home because school children spend nearly 6 to 8 hours a day in their childhood. The following criteria are recommended to maintain the wholesome or healthful school environment includes physical environment, sanitary and other facilities, disposal of waste and refuse, canteen and eating facilities, safety and emotional climate. Let us discuss one by one these criteria. The physical environment includes 11 different points. That is, first one is the location and the site of the school, the building structure of the school, classroom furnishing, floor, the doors and windows, color, lighting, furniture, playground, beautification of the school and the school garden. Let us discuss these points. First is the location and site of the school. The school has to be centrally located in a place. The area should be noise-free, dust-free and away from the traffic and even away from busy places or roads, cinema theatre, factories, railway tracks, market, bar and restaurant, etc. And the school has to be properly fenced and it has to be protected with a compound wall. Selection of site. The site should be dry, raised surface and it should be raised surface with a proper drainage system. The School Health Committee recommended in 1961 regarding the site and location, there should be 10 acres of land for higher elementary school and there should be minimum 5 acres of land for primary school. 10 acres for higher elementary school and 5 acres land for primary school. In addition to that, there should be 1 acre of land per 100 students. 1 acre of land per 100 students. And this site will be at least half kilometer away from river, industry, waste disposal area, airport, etc. Next is regarding the building structure. It should be single-storied building for nursery and secondary schools. Until nursery and secondary school, the building should be single-storied. The material used for the construction of the building should be easily cleaned materials, and it should be insulated from heat, rain, noise, etc. The school should have the facility for the fireproof, and there should be facility for adequate fresh air and ventilation. For the good light and air, the height of the classroom should be at least 12 feet according to the recommendation of the school health committee. So, height of the classroom should be at least 12 feet to get adequate or good light and air circulation in the classroom. The third point is the classroom. Classroom should be well ventilated with adequate cross ventilation. There should be attached verandas for the classroom. And one classroom, usually as per their 1961 recommendation, it should be not more than 40 students, but at present it varies as the class strength has been increased. Then per capita space for a student to have an adequate ventilation should not be less than 10 square feet according to the recommendation of the School Health Committee 1961. The per capita space for each student should not be less than 10 square feet. That means minimum 10 square feet per capita space for each student should be available in the classroom. Then regarding the floor. Floor should be clean, smooth and easy to wash. It should not be slippery. And all the staircases should have the railings for the protection. Then size of the classroom or floor should be 4 meters height, 8 meters long and 6 meters wide. According to School Health Committee recommendation, there should be 4 meters height, 8 meters long and 6 meters wide for the classroom floor. Then each student should have 5 cubic meter of space for an adequate ventilation and 10 square feet of floor space. So you can see this diagram. The height is 4 meters and 5 cubic meter space for each student, and each student should have 10 square feet of floor space. So the floor has to be constructed according to the number of students with this recommendation. Then doors and windows. The doors and windows should be broad and height of the door should be 6 feet from the floor level. Height of the door should be 6 feet from the floor level. And the total classroom height should be 12 feet or 4 meters. Then for the cross ventilation, the windows should be constructed 150 centimeter down from the ceiling and 120 centimeter up from the floor. So for the cross ventilation, the window has to be constructed in the classroom, that is 150 centimeter down from the ceiling and 120 centimeter up from the floor. The total windows and doors of the classroom should cover at least 25% of the floor space according to the recommendation of the School Health Committee. Then ventilation of the classroom should cover at least 2% of the total floor space. So doors and windows should cover 25% of the floor space and ventilation should cover 2% of the total floor space. Then color. The inside of the classroom, it should be well if it is given white color, and the color of the classroom has to be periodically whitewashed, that is at least once in a year, and the total outside of the school should be given light colors which reduce the glares according to the School Health Committee recommendation. Then regarding the lighting, there should be sufficient natural lights in the classroom, that is from both left and right side of the students. As we have already discussed, the window has to be constructed as 150 centimeter down from the ceiling and 120 centimeter up from the floor, and there should be cross ventilation from the both side, right and left side from the students. The next is regarding the furniture. The furniture should be suited with the age group of the students. Desirably single desk with a chair. So each student should have a single desk with a chair, that is a desirable according to the School Health Committee. And the duster should be always cleaned outside the classroom to prevent the allergic reaction, that is dust allergy to the students and the teacher. Next is playground. The school playground should be dry, smooth and safe. It should be partly planted with the trees to give a shade. And there should be facility for attempting all the games and sports in the school ground. Then space can even provided for school garden, fish pond or poultry farms, etc. Next is the beautification of the school. The 10th point is beautification of the school. School should have a good appearance. Whitewashing and coloring should be done annually once in a year. And students should be encouraged to keep the building and surrounding clean always. And there should be periodic cleanliness campaigns. So there should be cleanliness campaigns periodically. Next is school garden. Every school must take a plantation of trees and develop simple gardens, either kitchen garden or other general garden. The wastewater can be effectively used for the garden and the trees. So every school must take up plantation of trees and develop a simple garden, even kitchen garden. The second main health services under the Wholesome or Healthful school environment is sanitary and other facilities in the schools. It includes mainly water supply and laboratory services. So first one is water supply. Water supply should be continuous, portable and safe. It can be from the tap or from the well. If it is from the tap, the area surrounding the tap should be clean and dry, and there should be proper drainage system. Then if it is from the well, the well has to be periodically chlorinated. The school health committee is recommended one water tap for 50 students and one port for 30 students for the drinking water. One water tap for 50 students and one port for 30 students. Then laboratory facilities. Each school must have sanitary urinals and latrines with adequate water supply. That should be separate for boys and girls. One urinal for 60 students and one latrine for 100 students are advocated. Ideally, it is one urinal for 40 students and one toilet or latrine for 60 students according to the school health committee recommendation. That is one urinal for 40 students and one toilet or latrine for 60 students are ideal. The third main activity under Wholesome school environment is disposal of waste and refuse from the school. It includes disposal of refuse and disposal of waste water. First is disposal of refuse. Dustbin must be placed in each classroom and various other strategic areas. It should be emptied either in the compost pit or it can be burned in one corner away from the classrooms. The compost from the pit is an excellent manure. It can be used for the school garden. Second point is disposal of wastewater. There should be proper underground drainage system for the disposal of wastewater in the school. Sockage pit can be used in the rural areas, and moreover wastewater even can be used for the school garden. The fourth main activities or health services under Wholesome school environment is canteen and eating facilities in the school. Each school should have its own sanitary canteen or approved vendors in school premises. There should be facility for eating and washing hands in the canteen. Then fifth major activity is safety. School should provide safe, secure and comfort environment for the students. So safety in concern with the school building, safety in concern with the playground, safety in the compound and other safety measures. Let us discuss one by one. First is regarding school building. So the school building should have a fireproof. Then fire drill should be held at regular intervals. Then about the playground. Playground should be free from stones and other dangerous materials. Then regarding the compound of the school, it should be free from rubbish and undergrowth to avoid the health hazards from the snake, scorpion, etc. Then others. There should be periodic maintenance and repair of all electrical appliances in the school. Then special precautions for lakes, ponds, rivers, wells, etc. has to be done. Then particular attention should be given to prevent the stray animals, especially stray dogs, entering into the school compound. Then traffic rules should be taught to the students to prevent the road accidents. The sixth main area under Wholesome school environment is emotional climate. The climate should be conducive for the overall development of the student or the personality development of the scholar. There are 5 different ways. First way is early detection of any deviation from the scholar. Then making adjustment in school programs. Minimizing tension and stresses among the students. Provision for opportunities. Then encouragement of their achievements. The first way for the emotional climate is early detection of students who deviate from the normal. Then making adjustment in the school programs or school activities to meet the needs of the child's mental capacity. Then minimizing the purposeless tensions and frustrations among the students or school children. The fourth way is providing opportunity to the children to make decisions and develop responsibilities and leadership quality. Then fifth way is encourage each child and emphasizing his achievements rather than his failures. So encourage the achievement of the students rather than their failures. So the second main activity under health promotive and protective services is maintenance of personal hygiene. So the second activity is maintenance of personal hygiene. Maintenance of personal hygiene is very essential for the promotion of health of the students. The teacher has got a significant role here. Teacher can be either role model or she can educate and encourage the children to follow good personal hygiene. And even she can do the daily inspection of the students about their personal maintenance of personal hygiene. The third activity is nutritional services. The importance of nutritional services is a child who is physically weak will be mentally weak, and she or he cannot perform well in the classroom. That may lead to poor scholastic performance. So nutritional services is very important because a child who is physically weak, automatically she will be or he will be mentally weak, and he cannot or she cannot perform well in the classroom. That may lead to poor scholastic performance. The nutritional services includes midday meals, applied nutrition program, and specific nutrients supply, supplementation of specific nutrients. So first is about the midday meals. Midday meals are the practical solution to combat malnutrition in children. The goal of midday meal is at least one nourishing meal per day to the children. The second goal is at least 1/3 of the daily caloric requirement for the children, and about half of the daily protein requirement has to be covered in midday meals. Then third goal is it is no profit and no loss basis. It is based on no profit and no loss. So these are the three goals of midday meals. The second program is Applied Nutrition Program. It is a part of the UNICEF program. In this program, Applied Nutrition Program provides seeds, manure, and water supply and other equipments necessary wherever land is available in the school to develop the school garden. That is Applied Nutrition Program. The next is Specific Nutrient Supply. The need for specific nutrient supply are, it is necessary for the prevention of some nutritional disorders such as dental caries, endemic goiter, protein energy malnutrition or caloric energy malnutrition, anemia, etc. They are common in school children and in this age, which includes supply of milk, egg and other supplements to the school children. These are the three nutrition programs for the school children. The next level of activities is physical and recreational activities. The need or importance of physical and recreational activities at the school is, first is to promote the growth and development in the school children or among the school children. Second is help to release the physical and mental stress and tensions of the school children. And third is inculcate a team spirit among the children and to promote the optimal scholastic performance, academic performance in school children. So these are the need and importance of the physical and recreational activities at the school. Then here the school health team should take a keen interest and effort to ensure that school authority organizes a regular program of physical and recreational activities in the school. So there should be a regular program of physical and recreational activities in the school that has to be made sure by the school health team. The next main area of activity is promotion of mental health. First is the need for promotion of mental health. Mental health of the child affects the physical health and of course indirectly the learning process of the children. Then moreover the juvenile delinquency, maladjustment and drug addictions are becoming an important problems among the school children nowadays. The school is the most strategic place for shaping the behavior of the children and promotion of the mental health of the school children. The school teacher has both a positive and a preventive role. He or she should be concerned with the helping all children to attain the mental health so that they may develop into mature, responsible and well-adjusted adults in the future. The activities included in the promotion of mental health is, first one is organizing a well-balanced curricular, co-curricular and extracurricular activities in the school. And second is there should not be any distinction or discrimination among the students. So no distinction or discrimination should be made between the race, religion, caste, community, between the rich and the poor, between the clever and the dull among the students. Then there should be adequate provision for vocational and psychological guidance and counseling services in the school. Nowadays it is the need of the day to provide vocational and psychological guidance and counseling for the school children. The next activity is health education. Health education is the most important element or key of school health program. The goal of health education should be to bring about the desirable changes in the health knowledge, attitude and healthy practices among the school children. So to bring about the desirable changes in health knowledge, health awareness, then positive attitude towards health and healthy practices among the school children. Here the children's parents and teachers all together should involve in planning and carrying out the school health services. The important thing here, we consider every school child as a health worker because they convey the message what they grab from the school to the neighbors, to the relatives, to the family members, etc. So every school child is considered as a health worker. Health education or health awareness program in the school should cover the following areas, that is personal hygiene, attention to posture of the students, healthy habits, environmental health, family life, nutritious food or balanced diet, prevention of communicable diseases and non-communicable diseases, then tomorrow's parents, today's children are tomorrow's parents, road safety, first aid and emergency, primary health center and its functions, then sex education, prevention and control of psychological problems among school children. The next area of the major activity is immunization. The immunization of the children should continue in the school. It should be inquired on admission, their history of the immunization. A well-planned immunization program should be implemented at the school. Then which includes, so if there is no clear history of immunization, it could be well given 2 doses of DT at 4 weeks interval in 5 to 6 years on admission. Then 2 doses of TT at 1 month interval at the age of 10 years and again at the age of 16 years. And of course, the teenager has to be given the rubella vaccine at the school. Then in short, if there is no clear-cut history of immunization, 2 doses of DT, 2 doses of TT, MMR or rubella vaccines and other vaccines according to the geography and endemicity of the particular area or location of the school. If immunization has been done completely, then 1 dose of DT at 5 and 6 years, 1 doses of TT at the age of 10 years and again at the age of 16 years. And moreover, the proper record of the immunization has to be maintained or it has to be entered in the school health record. The second broad classification of the school health services or program is therapeutic services. Therapeutic services are mainly classified into health appraisal or health monitoring, then treatment and follow-up, then first aid and emergency care, and last one is specialized health services. Health appraisal includes 2 areas of services, that is daily inspection by the class teacher and periodical medical examination of the school children. Then followed by treatment and follow-up, then first aid and emergency care whenever it is necessary. Then specialized health services or clinic has to be conducted at school like dental health, eye health and even for ENT health. Let us discuss in detail about the therapeutic services. First is health appraisal or health monitoring. Health appraisal or monitoring is not only for the students but also for all the teachers and other school personnel who has been involving in the school activities. It consists 2 areas of services. One is periodical medical examination. Second one is daily inspection by the class teacher. First is periodical medical examination. The medical examination has to be done at the time of entry, then every 4 years. So the medical examination has to be done at the time of the entry, then every 4 years. Then there would be minimum 3 health appraisal during the school period. That is, one is at the entry, that is 5 to 6 years. Then on passing out from primary school, that is at the age of 10 to 11 years. And then last examination or appraisal is medical examination has to be done on passing out from the middle school, that is on 13 to 14 years or at 13 to 14 years. So there should be minimum of 3 health appraisal during the school period. Medical examination or periodical medical examination should include complete physical and medical examination of the children, head to toe exam or head to foot exam, anthropometrical assessment, testing of vision, hearing, speech, etc., observation of vital signs, a routine blood examination or investigations, urine and stool examinations, clinical exam for nutritional deficiency and screening for the test of TB, etc., tuberculosis, etc. The second area is daily morning inspection. It has to be done by the class teacher. Class teachers have a unique position to carry out the daily inspection as they are familiar with their children and they can detect the early changes which happens in the children or in the child. So these are the following clues which help the teacher in suspecting the children who need medical attention. The first one is unusually flushed face. Second, any rash or spots in the skin. Symptoms of acute cold. Coughing and sneezing. Sore throat. Rigid neck. Nausea and vomiting. Red or watery eyes. Headache. Chills or fever. Listenlessness or sleeplessness. Disinclination to play. Unwilling to or reject to play. Diarrhea. pain in the body, any part, general or local pain, skin conditions like scabies, ringworm, etc., and even pediculosis. So these are the clues which help the teacher in suspecting the children who need a medical attention. So under therapeutic services, the second area is treatment and follow-up. So in school health program, generally or routinely medical examination should be followed by appropriate treatment. The special clinics should be conducted exclusively for the school children at PHCs in the rural areas. So the special clinics should be conducted exclusively for the school children, only for the school children at PHC in the rural areas. And in urban areas, one of the school can be selected for minimum 5,000 children. Then all the follow-up services should be done by the school health nurses. The treatment and follow-up should include preventive, promotive, curative, corrective and rehabilitative care to the school children. So integrated services, school health services. The third area is first aid and emergency care. Usually the teachers who are available at the spot of any accidents or emergency responsible for giving first aid and emergency care. All teachers should receive adequate training of first aid and emergency care, or there should be an in-service education program for the teacher for the adequate knowledge of first aid and emergency care. Then even senior students can also be involved and trained in first aid and emergency care in the school. The emergency commonly met within the schools are either an accident, minor or serious injuries can occur in accident. Then medical emergencies such as gastroenteritis, colic pain, epileptic fits, fainting, etc. There should be a fully equipped first aid box in the school. So a fully equipped first aid box must be available in the school to treat the emergency. Then fourth areas of the therapeutic services is specialized health services, which includes dental health, eye health and ENT, ear, nose, throat health services. First is dental health. Dental caries and periodontal diseases like gum bleeding, etc. are common in school children. School health program should give a provision for the dental examination at least once in a year, because to prevent and tackle the dental caries and periodontal diseases among the school children. Second special services are eye health services. The special clinic for basic eye health services should be provided, and there should be a periodical examination of the eyes, and moreover vitamin A supplementation or administration to the children at risk of vitamin A deficiency. Then third special services, ear, nose, throat health. So special clinic should be provided for ENT services. Specialists should be invited on the specific days to hold the clinics in the school health services, which must include examination, treatment and follow-up services in this special areas of services like ear, nose, throat health services to the school children. The third broad aspects or components of school health services is rehabilitative services, which includes education of handicapped children. The aim of education of handicapped children is make the child to reach his maximum potentials, ability, capability to lead a normal life and to become a productive and self-supporting member in the society. So the aim of education of handicapped children is make the child to reach his maximum potential to lead a normal life and to become productive and self-supporting member of the society. Rehabilitation services should be given for both the physical disability and mental disability. The marked disabilities such as blindness, deafness, autism, MR, mental retardation, etc. should be trained in a special schools and they should be given special rehabilitation program. Children with minor, that is physical mental defects, may be kept in the normal school along with the normal children. Then in addition to that, the teachers, health workers need to give more attention and focus and care to these physiologically challenged children. The last broad areas of or components or aspects of school health services is school health record. School health record is a cumulative health record. It is essential for each student, and it should include identification and personal aspects of the school children, personal and family history of the school children, finding of physical and medical examination has been conducted during the school health services, findings of routine investigations and the screening programs of the school children, and the services rendered and the prognosis of the services of the children. School health record should be complete, accurate and continuous. It is useful to provide need-based comprehensive services to the school children. It helps even to evaluate the school health services or school health program. It should be kept in safe and secure place under the custody of the class teacher. School health record should act as a communication tool between the teachers, medical officers, school health nurse and the home. And it can be also used for the administrative and legal purpose. So far we have discussed about the school health services or school health program, its aspects, components and elements. Broadly, it is classified into 4 areas, that is health promotive and protective services, therapeutic services, rehabilitative services, and last one is school health record. So thanks for watching. Hope this video really benefits in your studies. If you feel it is worth and benefit, please like, share and subscribe my channel. Stay tuned with the Angel Health Academy till we meet with another important educational video. Thank you.